Good day everyone, I'm Alan Margo J. Padora and I'm your student nurse for today. Now, let's do the hand washing and surgical hand scrub procedure. Assemble all the equipment: nail cleaner with sterile brush, antimicrobial surgical hand scrub, disposable or sanitized towel, and warm running water from faucet. Assess the hands. Nails should be kept short, long or polished nails, increased number of bacteria residing on nails. Long fingernails can puncture gloves causing contamination. Remove all jewelry. Jewelry may harbor or protect microorganisms from removal. Check the hand for breaks in the skin, such as hangnails or cuts. Broken skin permits microorganisms to enter layers of the skin, providing deeper microbial breeding grounds. Put on protective attire prior to the beginning of scrub. Mask prevents escape of microorganisms into air that can contaminate hands. Other protective wear prevents exposure to blood and body fluid splashes during the procedure. Wet hands and apply soap. Turn on the water and adjust the flow so that the water is warm. Warm water removes less of the protective oils than hot water. Wet hands thoroughly by holding them under running water, letting it run from the fingertips to the elbows. Hands are the most contaminated parts to be washed. Water flows from the most to the least contaminated area, rinsing microorganisms into the sink. Apply 2 to 4 ml of liquid soap to the hands, but hold hands higher than the elbows during this hand wash. Ensure that all surfaces of the hands and fingers are cleaned with enough soap. Thoroughly wash and rinse the hands. Wash hands using friction on all surfaces. Friction and rubbing mechanically loosen and remove dirt and transient bacteria. Rinse hands tolerably by letting the water run from the fingertips to the elbows until the soap is removed. Rinsing removes transient bacteria from fingers, hands, and forearms. Open the scrub brush. Obtain the nail cleaner and clean beneath and around each fingernail. It promotes reduction in microorganisms on all fingernails. Drop nail cleaner in the sink when complete. Dropping the nail cleaner would make less contact to any unsterile object. Scrub first one hand as follows. Place all fingers of one hand together and brush across nail tips for 30 strokes. It eliminates transient microorganisms and reduces resident hand flora. Mentally divide each finger and thumb into 4 planes and scrub each plane separately for 5 strokes. It promotes reduction in microorganisms on all fingers. Scrub the palm of each hand for 20 strokes using a circular motion. Then same goes with the back of your hand. It ensures complete antiseptic coverage of all hand surfaces, and circular motion and friction loosens resident bacteria that adhere to skin surfaces. Using the same brush, scrub the other hand using the same technique. Scrub first one arm as follows. Mentally divide one arm from wrist down to 2 inches from the elbow into 3 segments. Then divide each segment of one arm into 4 planes. Beginning with the segment nearest to your hand, scrub each plane with 5 strokes using a circular motion. This eliminates transient microorganisms and reduces resident hand flora. Moreover, it ensures complete antiseptic coverage of all arm surfaces. Lastly, circular motion and friction loosens resident bacteria that adhere to skin surfaces. Using the same brush, scrub the other arm using the same technique. After which, drop the brush in the sink. Dropping the brush would make less contact to any unsterile object. Rinse both hands and arms as follows. Flex your arms and wrists from the fingertips to the elbow in a single smooth motion, allowing water to drip from elbows. Always keep hands higher than the elbows to prevent water from running back from a non-scrub area to scrub area. Hands remain the cleanest part of the upper extremities, hence water should flow from the fingertips to the elbows, making it more sterile. Do not move the arm back and forth under the water. Moving back and forth would make microorganisms stay on the skin. It should be flushed by the running water. Avoid splashing water or lather onto the surface of the scrub suit or gown. Dryness should be maintained to avoid any breeding sites of microorganisms. Release water control and allow the water to drip from the elbow for a few seconds before moving away from the scrubbing area. Go to the sterile setup area and dry hands. Walk backward into the operating room while keeping your hands elevated at waist level with the elbows flexed in front of you but away from your body. Sterile objects or items should be facing sterile areas to prevent contamination. Walk to the table containing the sterile towel while keeping a slight distance from it. Pick up the sterile towel by its folded edge without dripping the water into the sterile film. Allow the towel to unfold without touching anything. Use one end of the towel to dry one hand completely using a rotating motion and moving from fingers to the elbow. Use the other end of the towel to dry the other hand and forearm in that order. This avoids the sterile towel from contacting unsterile scrub attire and transferring contamination to hands. Dry skin from the cleanest, which is the hands, to the least clean, which is the elbows. Furthermore, this prevents accidental contamination. Drop the towel into the designated receptacle. Dropping the unsterile towel makes less contact to any sterile item